Good morning. Thank you, Tan Sri Augustine Ong and my secretariat for this opportunity for me to share some thoughts and my experience at this conference. I'm trained as a dentist, and my field of specialty is in restorative dentistry that focuses on the diagnosis. Good morning. Thank you, Tan Sri Augustine Ong and my secretariat for the opportunity for me to share some thoughts and some of my experience at this conference. I am trained as a dentist, and my field of specialty is in restorative dentistry that focuses on the prevention, diagnosis, and integrated management of damaged or missing teeth and its supporting structures in order that the dentition can be restored back in function as well as aesthetics. I have spent a long career, which I find very fruitful and amazing in academia. And my first experience was in the University of Malaya, and I saw through the first batch of graduates from University of Malaya until the year I left University of Malaya to join the International Medical University to start its dental program and School of Dentistry. Through my many years of work experience in academia, where I am actively involved in clinical management of patients, teaching, as well as research, I find that there is a necessity to have a paradigm shift in oral health care and dental education. Thus, today's presentation will cover the challenges that's facing society as well as the dental profession in the 21st century, the need for more dental professionals who are well prepared to meet these challenges, especially the role of the dental education institutions and professional bodies. COVID-19 pandemic has given us new challenges to face, and especially in patient and health professional safety. Our daily clinical management of patients now need to follow a stricter infection prevention and control protocol. However, with challenges, it also gives room for innovation. On my right, you can see the shield, which is a special device invented by Dr. Ma Jiufen that she utilizes in her clinic during patient treatment. This shield will minimize aerosol contamination of a clinic environment, and it is well accepted by her patients. So when we look at challenges of the 21st century, there are many that will affect our daily lives and the practice of our profession. There's the aging population, globalization, technological advancement, especially in diagnostic and treatment technologies, the Internet of Things, artificial intelligence and learning machines, genetic engineering, and big data. For the time allocated for this presentation today, I will not be able to cover all these areas of challenges, but I will touch on some of them. Now, the world is changing in demographics with increase in the elderly in the population. The persons aged 65 years and above have been increasing through the years, and especially so in Eastern and Southeastern Asia, and Malaysia is by no means different. But if we look at the dentition of this age group, the senior citizens have a high percentage of edentulism, which means they do not possess any teeth. Now, if we do not have teeth, then our quality of life will be affected. And if we look at the common causes of tooth loss, which is through dental decay or dental caries, as it's known, you will find that in the senior citizens too have very high prevalence. The other disease in dentistry that has also contributed to tooth loss is gum disease or periodontal disease. And the prevalence in the elderly is also very high. But if we look at trying to manage the care of our patients, we do need medical personnel who are well trained. And in this Social Statistics Bulletin 2017 published by the Ministry of Health, we can see that the dentist to population ratio is still very high. There's only one dentist to about 4,000. And if we look at even today, Malaysia population per dentist is about nearly 3,500 for each dentist. Whereas if we compare to the other statistics in developed nations, they are less than 2,000. So we do need more dental personnel. And if we look at the distribution of care in the dental clinics, whether private or public, you see them mainly in the Peninsular Malaysia, especially concentrated in the big cities. And in East Malaysia, the number of clinics available for oral health care is very nominal. And we know that oral health is essential for quality of life and healthy aging. I belong to the generation of baby boomers where we are still now active and we challenge the norms. All right. So these photos show some of my colleagues from other countries, and we are all still very active in the dental professional world, sharing of our experiences and trying to change the norms to meet the challenges of the 21st century. And as this conference is dedicated to women as well as their contribution to nation building, I would like to pay special tribute to Dr. Mei Ling Yang, who sadly passed away in January, but she was the co-founder of the International Medical University, a rather unique university that concentrates on bringing high quality education in Malaysia, as well as being recognized worldwide with many partners to bring quality education in health professional education to Malaysia. She is an example of a fine person who nurtures all the staff and students to have better care for the future. In healthy aging, we look for proper nutrition, healthy lifestyle, and the Ministry of Health have implemented many evidence-based health promotion and disease prevention programs. All these are in the norm. But for me, I feel that it is necessary to include oral care plan developed and monitored with oral health professionals if we want to promote oral wellness. That means each person should have a personal dentist to have an oral care plan for them throughout life. Oral wellness is a state of complete physical, mental, and social well-being, and not merely the absence of oral disease or infirmity. And this is adopted from the World Health Organization of Wellness. Maintaining an optimal level of oral wellness, is absolutely crucial if we wish to live a higher quality of life. The action taken by our country, especially in the Ministry of Health and the dental profession, is in the area of prevention of these common diseases. And if they fail and there are disease found in the mouth, restoration of the damaged teeth or missing teeth is carried out. I feel that there is need to have an extra step taken besides prevention and restoration, and that is interception. With the new knowledge with us through research, we know that we can intercept the disease rather than wait for it to cause a lot of damage to our dentition and then do a restoration. We know that teeth that are damaged are irreversible. And when we lose tooth structure, we need to restore it back. And if we do not take steps to restoring back, we can even eventually lose the tooth. There is need for a paradigm shift to say that instead of concentrating on restoring damaged teeth, we need to stop disease progression and even, if possible, reverse the disease state. The traditional approach in dentistry of drilling and filling and patients expecting dentist work is to drill out the decay and fill up the gap, and is to look at a more cost-effective evidence-based preventive model to decrease the disease burden. We now know through a lot of research that sound enamel become caries or become decay when there is plaque and sugar in our diet and in our oral environment, causing demineralization of the enamel and thus irreversible damage. However, when enamel is carious in the initial stages, we can actually stop the progression or even reverse the carious enamel to become sound enamel if the oral environment is correct with good saliva, antibody, a fluoride, modified diet, and effective plaque removal. Thus, we'd like to promote an interception through maximum interception and minimum invasion philosophy. MIMI is a philosophy of professional care concerned with the first occurrence, earliest detection, and earliest possible treatment of the disease at micro or molecular levels, followed by the most minimally invasive and patient-friendly options to repair irreversible damage caused by such disease. MIMI aims to empower patients through information, skills, and motivation to be in charge of their own oral health so that they only require minimum intervention from the dental profession. Thus, a person is then encouraged to keep their teeth for life. When we look at management of the oral environment to make it conducive for a healthy or dentition, there is need to identify the level of risk and the identification of what risk factors each person to look in management of the oral environment. There is a necessity to do caries risk assessment or periodontal risk assessment of these two common diseases by identifying the level of risk each person possesses in identifying their risk factors. Once this is done, then the dentist can give a strategy in managing these risk factors for the patient. Thus, it is personalized care, and with monitoring of early lesions, a remineralization strategy of caries lesions can occur, stopping the progression of such disease to irreversible damage. In 2010, we established the IMU Oral Health Center, which is a dental clinic offering services to the public that is provided by our students as well as our staff. And when we set up this clinic, we have a mission to transform lives through oral wellness. By bringing this message of the need for patients to maintain their oral wellness, we have used a wide variety of learning methods to bring this message of patient-centered care to our students. And caring as is tantamount in patient-centered care. We shape compassion as an expected professional component of care. Thus, teaching methods including patient-centered communication. Thus, teaching methods include patient-centered communication, identifying and solving challenges in real-world in a real-world setting. Thus, teaching methods include patient-centered communication, identifying and solving challenges in real-world setting of various communities, self-reflection exercises, and compassionate role modeling are techniques that we use in our program to nurture compassion from an innate quality in our students to become a sustained practice. Community Partnership Program is integrated in our undergraduate curriculum to provide interprofessional experiential learning in the care of institutionalized elderly people. And this is just an example. We do care for many types of communities, including besides the elderly. But in the elderly, this is an example I would like to share where we carried out this project in my father's home using students from many different programs, and they all work together to look at the needs of this community. We find that in this community, 33% of its residents are bedridden or chair-bound. 23% are ambulatory, but they do not go out, and only 44% goes out. So the students do history taking, weight measurement, and do all sorts of examination on the residents in order to identify their needs. Then they look at how these needs can be managed and come up with intervention plan. At the end of each visit, there is a debrief session between all the various disciplines in order to come up with a concerted strategy to assist the residents in controlling their health problems. So key things that they have identified are malnourishment that can be caused from poor dentition, dry mouth, and aging also cause changes in taste. Therefore, all the different disciplines work together to come up with solutions for better care. Besides caring for the disease status that is found and the illness, the students also come in to care for the mental health and the social well-being of the residents by having parties, sing-along sessions with the residents. Now I'd like to come to share a bit about my research. My research interests are varied, and one key research area that we did was looking at implant design and how our tissues react to these implants once placed in the mouth. So this is our team of researchers, which is a collaboration with the University of Frankfurt and Professor Dr. Romanos. He was then a postgraduate student who was a lecturer in the University of Frankfurt. This is the team members of my implant. This is the team members of my implant research, which consists of multidisciplinary team from the University of Malaya, such as an oral maxillofacial surgeon, a periodontist, oral pathologist, myself as the restorative dentist. As together, we work with the University of Frankfurt, and this is Dr. Romanos, who visits us in the University of Malaya to jointly conduct the study that's carried out in macaque monkeys. And these are our support staff who assist us in this research. We did many types of investigation, but one that is very significant is how we did a controlled study to look at decreasing the time spent in delivering of implant treatment. The protocol that was utilized before then, the protocol that was used for implant treatment requires a long span of time, with the time when you place in the implants into the jawbone and allowing 3 months for it to heal before you even want to consider opening up and connecting the abutments to have some artificial teeth connected to the implants. In our study, we said that you can connect the implants and give it some loading immediately on the day of surgery. So when we did the control study where one side of the jaw has immediate implantation and the other side the conventional method, we have found that the immediate implant, even in the posterior region, can work with occlusion. There was a fear that when you bite on immediately placed implants that the movement from the occlusion can cause the implants to dislodge. But when we see that when the environment is controlled, this can be carried out successfully. Thus, this paper or this research results was presented in Geneva, and we found that we were awarded the gold medal with felicitations from the jury, as well as the Ministry of Higher Education gave us the Team Excellent Scientist Award, as well as we received a gold medal, by the Public Institutes for Higher Learning, Research and Development exhibition for carrying out this study. The clinical portion of this study that repeats the protocol carried out in macaque monkeys was carried out in Germany on human beings, and they came out with the same conclusion and success rate as our monkey study. Now, in the area of internet, it has connected us with many things, and the technology the internet brings has brought us into Internet of Things being developed, such as dental navigating system, tooth-located GPS person tracking system. You know, we can track a person or a child if we put in that system into a tooth as a restoration, or a microchip implant, or even a barcode in a denture. So all these technology can assist us in tracking people, as well as being more precise in our treatment. And one of this that I'm now still actively involved in, that excites me a lot, is development of a dental treatment decision support system using artificial intelligence. And we have now come up with a prototype that is ready for clinical trial. Later, we are going to add even more modules into this system to make it even more robust to be used in the clinical dental environment for more accurate evidence-based delivery of dental oral health care. Artificial intelligence and learning machines have also will. Now I would like to share with you an extract. From Scientific American of the possible contribution of artificial intelligence and learning machines. It says, you awaken in the middle of the night. That tooth that's been a little sensitive lately is throbbing. By morning, you realize you have a real problem. So you head into the bathroom, plug your smart toothbrush into your smartphone, and when you put the brush in your mouth, it scans your teeth. The images automatically upload to the cloud. They are analyzed by artificial intelligence, which finds a cavity in your aching tooth and a hairline crack in your molar. The scans and preliminary analysis are transmitted to your dentist, who then texts you to schedule an appointment. And in China, they have published and shown us that they have come out with a device that can fit implants into a patient's mouth without the dentist's direct intervention. The future is coming, and it will be amazing. I would like to acknowledge all these people who have played a significant role in influencing me in my career, and I thank them very much. Thank you. I would like to share with you my latest research interest that is keeping me very excited about the future of dental treatment, which is we are developing a dental treatment decision support system using artificial intelligence. And in this research, it is supported and in collaboration with the Q&M Dental Group. All right. And we have already in the final stages of coming up with the prototype that will soon be put into clinical trial. This system will then go to be used in the clinic to support diagnosis as well as evidence-based clinical care for patients.